Hi, I'm Very, and today on Naked Skincare, I want to start talking about some of the psychological benefits of skincare. Now, a lot of us come to skincare because we're wanting to improve our looks. For me, it was realizing that even though I had kind of coasted on very lucky genes that gave me clear skin, and I never needed a lot of product on my face, as I got older, the lack of care started to show, and not in any significant way, but just in little things. My skin was duller. I was starting to look closer to my age, and I never feel my age, and for me, that's a motivator. It's not that I want to look young, but I want to look how I feel. And I never really relate well to people my age because I feel so much younger. And so when I started skincare, that was kind of my motivation. And what I didn't expect was, first of all, that I would start to really enjoy doing it. That there's so many great products out there that feel good and smell good, and I just love them. I've become a bit of a skincare junkie. No surprise to anyone that knows me because I do have a bit of an obsessive personality. But then I started to notice other benefits, and I'm going to do other tapes to talk about some of the longer term, deeper issues, but I wanted to talk today about real short term benefit of skincare, psychologically speaking. Psycho-emotionally is how I usually think about it, because man, it's nearing the end of January, and health-wise, my January has sucked. The second week of January, I had a fibro flare, and through the use of the supplements and diet and all, I've gotten to where the pain from my fibro is really, really low. And even when I have a flare, I'll feel really sensitive, but I don't really have a lot of pain. What really hits me when I have a fibro flare is the fatigue. It is just debilitating. It always starts in my arms. When my arms start to feel like lead, that's kind of an early warning sign. And a lot of times I'm lucky if I take the next day or two off and rest and really take care of myself, I can bypass it. But wasn't so lucky this time, and it was a little over a week of just debilitating fatigue. And I didn't have the energy to cook for my family, which is something I really enjoy. I didn't have the energy to do the work stuff I wanted to do. I didn't have the energy to do stuff around the house and in the yard that I like to do. Wow, it was awful. And I felt like such a slug. And I was just getting over that when all of a sudden I was hit with absolutely excruciating jaw pain. Now, I've had chronic pain since my mid-teens, so we're talking like 40 years here of chronic pain that can sometimes get severe. From the fibro, I have arthritis in like 90% of my body, and I've learned with diet and supplementation to really keep that at a very low pain level, but I've experienced a lot of pain from health issues. And I've had kidney stones several times, and man, those are excruciating. And let me tell you, after I had kidney stones, I had no doubts about childbirth because it doesn't hold a candle to kidney stones. But this pain, it rivaled the kidney stones. It was unbearable. In 48 hours, I got maybe 4 hours of sleep before the pain would wake me up, and it was just excruciating. I ended up going to the emergency room in the wee hours of the morning, only to find out that I had an infected tooth. Wow. Went to my regular doctor to get some pain meds because they're very good about helping me with short-term pain management issues because they know me. I don't regularly take pain meds. I only occasionally take over-the-counter stuff. Again, I try to manage my pain with other methods. That was kind of drilled into me early when I was diagnosed with the fibro, because no matter whether it's narcotic or non-narcotic or over-the-counter prescription, eventually you build up a level of immunity. And if you're relying on prescription pain medication or even non-prescription over-the-counter stuff, eventually it just becomes less effective. So I try not to use it, but I was just desperate for relief. I was just excruciating. I was lucky. I got an appointment with the dentist. I have huge PTSD issues with dentists and had not been in 20 years. And I'm not going to tell you that's a good thing. I had my reasons. I brush several times a day. I water floss. I take good care of my teeth as well as you can take self-wise. But, you know, going to a dentist is a good health practice, and I know that mentally. But this forced me, but I was really lucky, found a really great dentist. And at the end of this week, now that the antibiotics have had a chance to work, I'm going in and they're going to extract the tooth and clean out the thing, and then we're going to start working on an implant for that space. But here's the thing. I felt lousy. And even now, feeling so much better. So much better. But with the infection, that kind of took away, that really takes a toll on you too. And especially the medication, the antibiotic, is every 6 hours. And I have to sit up for a period after I take the dose. So I'm not getting a full night's sleep at a time. My sleep is coming in 2 segments because it's every 6 hours. So that's had a toll, and thank goodness for food delivery that could get some things delivered and grocery delivery, because I just have not been up to doing that. I have managed to make myself oatmeal every morning and my tea once I could once again stand hot liquids in my mouth. But it's really taken a toll, and now that I'm feeling better, I'm starting to have the side effects of the antibiotics, and I know that it's literally going to take months to restore the unbalance to my body, and I've already been planning some diet changes to speed that along, but it's really taken a toll. But the one thing that I have done every day, no matter how bad I felt, was skincare. Now, some days I didn't do much more than a wet washcloth and one of my face milks, or maybe one of my facial oils. When I would have a period when I was feeling better, I would, whether it was morning, afternoon, or night, I would take that time to do more extensive skincare. A couple times I just staggered into the living room with a face mask, one of the sheet masks in my hand, and while I was laying there on my chair with my husband, I would just put it on my face, and he of course would go, "That looks really attractive, babe," and I'd go, "Just for you, babe." But I have to tell you that in all the turmoil between my fibro and the tooth infection problem, the one normal thing I've had has been my skincare. And it's also helped when I felt like crap to at least look at my skin and go, okay, you're still looking okay. Your skin is still healthy. Because while parts of me are sick, my skin's staying healthy. A lot of days I didn't have the energy to do full body moisturizing. So when I would go into the bathroom for other things, I would like do my upper arms or do my lower legs or do a body part, so that throughout the day I was able to keep my skin moisturized. But being able to do something normal when life gets disruptive is just really helpful. It helps keep your spirits up. Let me tell you, pain wears on you. And a lot of people with chronic pain, we struggle with depression because pain wears you out and wears you down. And then to add to the everyday low-level struggle, to add that just really debilitating pain, wow. It was not fun. But having my skincare routine, it helped keep a little bit of normalcy in there. And it was something, skincare for me, I enjoy it and it feels good. So to be able to do something for my body that while it was in the midst of discomfort and pain, that felt good, was a really big, big help. So yes, skincare is healthcare, but it's also good for your mind and your soul. And don't dismiss that. There's sometimes some mocking when I speak about self-care because, as so many things in our culture, it's gotten turned into an industry to make money. But caring for yourself, even in times of distress, is important. And skincare is a way to do that. And still, skincare is healthcare.